After your Sculptra or Radiesse treatment, we want you to remember these things. You're going to be massaging in a motion as we showed you at your appointment, 5 minutes, 5 times a day for 5 days. Mild bruising and swelling is normal for a couple of days. It's going to take your Sculptra or your hyperdilute Radiesse treatment several weeks to start producing that collagen and elastin, so be patient. A little tenderness and maybe some mild pain can be normal while you're massaging. Things to look out for would be intense pain or skin discoloration. If you have any concerns, please call or text the office. If this was your first treatment, we look forward to seeing you again in 8 weeks for your second treatment. Some people require 2 to 3 treatments. We spread these 8 weeks apart. Once you've completed your Sculptra or hyperdilute Radiesse treatments, you'll typically want to return to us to keep that collagen growth every 1 to 2 years. Remember, you're growing collagen and elastin with these treatments, so it's very important that you eat well, a well-balanced diet with a lot of protein and green vegetables, and take your collagen supplements. And lastly, if you're planning on continuing the Sculptra, Radiesse, and other treatments, you may want to consider our beauty bank. This will help you save money on all of your aesthetic treatments.
So you've scheduled your first pellet appointment with us. We've had your labs done 2 weeks ago. We've got your results. We're ready to dose you and get you feeling your best. We'd like you to go ahead and fill out those forms so that we can get you back and get you feeling better as soon as possible. If you're not able to fill out those forms ahead of time, please arrive to your appointment at least 30 minutes beforehand so that we can get those done before we take you back. So when you arrive for your first pellet appointment, one of our medical assistants will take you back, we'll check vital signs, and they'll get you ready to see your medical provider. Your medical provider will then review your lab work and get you set up to get your pellet. The actual procedure takes about 10 minutes, so we'll have you in and out feeling your best in no time. So you've gotten your pellets. So if you are female, keep that water-resistant bandage, that Tegaderm, in place for 3 days. During those 3 days, you can shower, you can let the water run across the Tegaderm, but you don't want to submerge in water, so no bathtubs, hot tubs, lakes, pools, oceans, etc. You also want to avoid really intense exercise, so you don't want to go do CrossFit that day. You want to try to take about 3 days, take it easy, and after those 3 days, you can take the entire bandage off, steri strips and everything, and go about your normal day-to-day. If you're a male patient, you'll leave that Tegaderm in place for 5 days, and you'll take it easy for about 5 to 7 days. Your pellets do last about 5 to 6 months. Unfortunately, there is a little more downtime with male pellets. For the first few days after your pellet's inserted, you may have some tenderness, some swelling, maybe a little bit of pain in the area. You can apply ice packs, you can take a Tylenol. Some things that would be abnormal and a reason to reach out to the office would be any drainage from the site, any warmth, excessive pain, excessive tenderness past those first couple of days. Before you left after your pellet was inserted, you should have scheduled some post-pellet labs. These are typically drawn within 4 to 6 weeks after your pellet was inserted to check to make sure that your levels are optimized and where they need to be and that you're feeling your best. If for whatever reason these labs did not get scheduled, it's super important to follow up with the office and go ahead and get those labs scheduled so that we can make sure that all your levels are where they should be. Your pellets start doing their thing many times within the first or second week after being inserted, so you should start feeling those improvement in symptoms over the next couple weeks. But we check those levels at 4 to 6 weeks post-pellet because that's when everything's kicked in and those levels are at their peak. We're so happy that you chose to do your hormone replacement therapy with us. We have pelleted over 1,000 patients last year, so you're in great hands. Please reach out if you have any questions or concerns throughout this process. And don't forget, you get 20% off your BioT supplements that were recommended during your appointment if you buy them the day of your procedure. So you just had your laser treatment done. Depending on which laser you had done, you should have received specific instructions for aftercare. However, as a general rule, these are some things to expect after a laser treatment. You can expect to have some mild redness, maybe some swelling. It's very important that you protect that skin from the sun, so no excessive sun exposure. You also don't want to take a really hot shower because that skin is more sensitive to heat. Be sure to put on your SPF. mineral-based if possible, and at least 30. Try to avoid any waxing or skin actives like tretinoin, vitamin C, hydroquinone for about 7 days post-laser or whatever your practitioner recommended. Follow up as directed for your next laser appointment. If you have any questions or concerns, please reach out. Remember, depending on which laser treatment you received, results can take time, so it may take a few weeks before you notice that huge benefit from your laser treatment. And sometimes things may look a little worse before they start to look better. Thanks for choosing us for your laser treatments. Your results are just as important to us as they are to you, so please reach out if you have any concerns or questions.
Congratulations on scheduling your biofiller appointment with us. Leading up to your biofiller appointment, 1 week before your appointment, we want you to avoid taking steroids or anti-inflammatories. This includes Advil, Excedrin, Goody powders, or any other anti-inflammatory. The reason for this is because these anti-inflammatory medications affect your platelet count. You also want to make sure that you're taking all of your supplements, eating plenty of vegetables and protein, and drinking plenty of water so that we get some good biofiller. As well, we have a lot of supplements that can enhance your PRP. These include microgreens, collagen, daily vitamins, all the things that will help make you healthy and keep your PRP healthy so that you get the best results. In order to avoid bruising, we recommend that you don't exercise the day of your treatment and that you avoid alcohol for a couple of days before your treatment. A couple of days before your appointment, and especially the day of your appointment, be sure that you're drinking a lot of water and that you're well hydrated. We look forward to seeing you at your appointment for your biofiller, this amazing rejuvenation and all-natural treatment. If you'll remember, a few months ago, we did some volume replacement in her cheeks and her temples, a little bit in her chin, a little lip fluff, and we also worked on her marionette lines here. At that same day, we also did some neurotoxin. It's been a couple of months, so now it's time for her deep laser resurfacing treatment. We're gonna focus on the fine lines under her eyes, some marionette lines here, and in her lower face. Our Helix Fusion laser is a deep treatment that uses 2 lasers, one for bulk heating the skin to help produce collagen, and the second part of the laser is the CO2 laser, which is going to help resurface, tighten her skin, help with some sun damage, and just rejuvenation of her whole face and neck. All right, so we finished her treatment. We're going to cool her off really quick. Afterwards, we're going to put on some exosomes to help her heal faster and send her home with some exosomes, some aftercare, and detailed instructions of how to heal from this deep laser for resurfacing, tightening, fine lines, wrinkles, and sun damage. Skincare in your 20s should be very simple. A cleanser for your skin type, a moisturizer for your skin type, and an SPF. When you are in your 20s, you're still making great collagen, your skin cell turnover is on point. Our goal in our 20s is to keep that youthful glow and protect our skin. Sometimes in your 20s, you do have skincare problems such as excess oil, acne, redness, and some rosacea. If you're someone who has skin that keeps you from feeling confident, we do have treatments so that you can enjoy your skin in your 20s. For a copy of our skincare guide in your 20s, comment below skincare in my 20s and we'll DM that over to you. In this guide will also be treatment options for problem skin even in your 20s. As a reminder, in your 20s, you can keep your skincare simple. There's no need to follow all the TikTok trends and Instagram trends that want you to buy all this skincare. Let's keep it simple. A cleanser for your skin type, a moisturizer for your skin type, and always SPF. Protect our youth and keep glowing. If you need guidance on picking out the best skincare for your skin type, come on in and see us. Let's book a consult and get you set up.
Are you the type of person that likes to get a facial, whether it's monthly, every 2 months, once a year? Well, did you know that we have a VIP Skin Health Club? And it is an amazing deal. It's a monthly facial, and it can include IPL, Glampire Facial, Forma, Skintrinsic, Aquafirm. We have many different facials to choose from and that are included as a part of your membership. It's $239 a month, so it's an amazing value. Also, as a member of the VIP Skin Club, you get 10% off of your skincare always. You get specials on your neurotoxin, several other perks that are great. So if you're the type of person that wants to improve your skin health, if you're already on a skin health journey, if you're just looking for some new way to treat yourself each month, this is an excellent program to join. If you're interested in hearing more about our VIP Skin Club, just give us a call or a text. Our number is 770-710-2339. We would love to talk to you more about it.
Qui vient dans mes rêves, qui vient me voir, posant sur mes lèvres un baiser d'espoir.
You've probably heard about GLP-1 medications, but you may have been wondering just exactly how they work in your body. GLP-1s actually mimic a hormone that we already have present in the gut, and what that hormone does is it helps you to balance your carbs and your sugars better, helping with insulin sensitivity, and it also helps with gastric emptying, which can help you to feel full quicker and for longer. With your stomach emptying more slowly, you'll notice that you're maybe not eating a full portion like you used to. You're feeling full quicker, and those effects last for longer. Your brain also gets the signal saying, I'm full, which helps you to stop eating once your body has had enough food. This can also lead to less cravings and less food noise. GLP-1s also help your pancreas to release insulin only when it's needed. So this can help you to better balance your blood sugars, and it can also help to lower your A1C if that's something that you've noticed has been climbing up. Overall, you're going to be eating less and snacking less and having less cravings. We've also noticed that GLP-1s help with inflammation as well, which can help with decreasing bloating and maybe even help with joint pain. Overall, just helping you to feel better and have more energy so that you can also put that energy into your workouts too. If you've been thinking about trying a GLP-1, but you've been a little bit nervous about it, or maybe if you have any further questions, you're more than welcome to come set up an appointment with us, and we'd be more than happy to go over these with you.
Many times after a significant amount of weight loss, patients will begin to notice changes in their skin. What's known as Ozempic face can be related to loss of collagen and elastin, lack of nutrients due to weight loss, significant amounts where we're decreasing our caloric intake, but unfortunately, many times we're decreasing our nutrient intake as well. This can many times lead to sagging in the jowls, deeper lines around the mouth. It can lead to loss of volume because we lose fat all over the body, including the face. And even if we don't want to necessarily lose fat in those areas, it many times can happen. The good thing is we have treatments to restore it to a more youthful appearance. The treatment plan that we utilize for this is to include a combination of dermal fillers like Contour and Lift, along with biostimulators like Sculptra and Radiesse, combined with lasers and RF microneedling. We use RF microneedling to stimulate collagen in the skin to regenerate, to create more collagen elasticity over time. This results in a more tighter appearance to the skin and an overall more rejuvenated appearance to the skin. Biostimulators like Sculptra and Radiesse work in a different way but yield similar results. Biostimulators, though, we are injecting a product to help fertilize collagen. And so this approach is great for patients who have that gaunt appearance. They've lost a lot of volume. So in addition to lasers and RF microneedling, we will use biostimulators to create even more volume and more collagen elasticity over time. And then the last step in the treatment plan is to incorporate traditional dermal fillers like Contour and Lift, which restore volume specifically to certain areas of the face. So to restore bone density, to place the fat pad up nice and high where it was before weight loss occurred. So we bring back the more youthful, vibrant, rejuvenated appearance to the face.
In your 30s, your skincare routine really begins to matter. In our 30s, we begin losing collagen and our skin cell turnover slows down. This means that our skin can appear dull and lifeless. As well, we'll start seeing tiny, fine lines start to develop, especially around our eyes and around our mouth. For your morning routine, you'll need a good cleanser, a good moisturizer, but you'll need to add a couple of extra steps into your skincare routine in your 30s. Along with your skin-specific medical grade cleanser, you're going to want to add a vitamin C product. Vitamin C protects your skin and is an antioxidant, and it gives your skin a brighter appearance. And it also protects our skin from the environment. Of course, in the morning, an SPF is non-negotiable. Our goal is to protect our skin. In your 30s, your nighttime routine is all about repair. You're going to want to start adding a retinol product at least 2 to 4 times a week. This is going to aid in skin cell turnover. This will help you avoid the fine lines that begin to settle in. Also in your 30s, it's great to start adding in an eye cream. This eye cream is made specifically for the fragile skin underneath your eyes and will also aid in preventing crow's feet and fine lines around your eyes. Let's remember that our 30s aren't about fixing aging, they're about preventing it. Your 30s are the decade that set up your skin for the rest of your life. The right routine now means fewer treatments later. Comment skincare in your 30s and I'll DM you my guide for skincare in your 30s. So let's talk about all 3 of our membership options and help make this more clear. The VIP membership Skin Club is great for the person who is ready to get the best skin of their life. Each month you will pay $239. This gets you a facial or a laser or microneedling and other facial options once a month for 12 months.
So now we have 2 additional memberships called the Beauty Bank and the Confidence Bank. The Beauty Bank is going to be for the client who maybe is not looking to do as many facials monthly, but is really wanting to invest in injectables, biostimulators like Sculptra, medical grade skincare. You still get 10% off on your facial treatments. If you're wanting to invest a little bit more and see results beyond what facials can accomplish, then this is the membership for you.
For our Beauty Bank, you are investing $99 a month, which goes straight into your client bank. This money is for you to budget and use for all of your treatments. And for doing that, you're going to get the best price on our dermal filler and our neurotoxins. For the Confidence Bank, you're going to invest $299 a month. This money goes straight into your client bank for you to use and budget for all the treatments and services that you want. Investing in a membership with us allows you to not have to chase sales, not have to call and say, how much is your Botox this month? How much are your dermal fillers? Are you having a sale? Because you're always going to be getting the best price on all of our services.
The investment that you're making is going directly into your chart as our patient and getting applied to all the services that you're already getting anyway. But in addition to those services that are already being paid for, you are getting discounts, further specials that are not open to anyone not in that membership. Many times patients will refer to us as a one-stop shop. And the reason they say that is they come to us for their weight loss and they end up also doing peptide therapy, hormone replacement, thyroid optimization, aesthetics, injectables, all the above. This is a way for us to reward your loyalty and give you the most benefits possible.
Thank you for letting us take care of you.
A common complaint we hear from many of our patients is they'd like to have a more defined jawline. They'd like to get rid of their double chin, tighten the skin. The best approach really to accomplish that is using multiple modalities, multiple treatments to achieve the most natural but desired look. The first treatment I really like for this area is RF microneedling with Virtue or Secret or Morpheus. So the reason that RF microneedling is great for this area is you tighten the skin by inducing collagen with the RF microneedling, but the heat can also be increased and it can actually decrease that fatty tissue to help define the jawline further. The second approach I like to treating the jawline is using neurotoxins, so Dysport, Jeuveau, Xeomin, Botox. Neurotoxin, you can actually relax the muscles that pull down the face, including the DAOs, the platysmals, and you can achieve what's called a Nefertiti neck lift using neurotoxin. And then lastly, the third approach I like to take to treating the jawline is using biostimulators and dermal fillers as needed to achieve volume, elongate the chin, define the jawline, and to also create more collagen over time in the area. All of these treatments together help to define the jawline, decrease the fat pad here, causing that double chin, and give an overall more youthful appearance to the lower face. So if you've been wondering if there was a non-surgical approach to treating the jawline, come see us for a face consult and we'll get you started on a treatment plan.
Here's what I tell my patients to expect in their first month of GLP-1 use or medical weight loss. The first thing is not to get discouraged within your first month, as some patients may drop a few pounds quickly, but others may not see much of a difference in those first few weeks. Your body is adjusting. The major fat loss might not be happening just yet. First, you're going to notice that you're feeling fuller longer and quicker. So your appetite's going to be dropping a little bit more, and you'll notice that those portion sizes are decreasing. Side effects like nausea, constipation, or bloating are very common in the first few weeks. Some things to focus on are staying hydrated and making sure that you're putting protein at the forefront of your mind. By week 3 or 4, your cravings are starting to level out, your energy is improving, and you're noticing that your blood sugar is being stabilized better. And this is when the real improvement starts to become noticeable. Just remember that the first month is the foundation. Focus on hydration, protein, mindset, and movement, and then you'll start to notice the changes in the scale as time goes on.
Why is it important to have hormone optimization? Our hormones keep us young. They help with our brain, they help with our muscle, with our cardiovascular system, with our energy. The first step in determining whether you're a candidate for hormone optimization is to schedule a lab visit with us. We'll draw your labs. Those take about 2 weeks to come back. After that, we will schedule a lab review and go over options for hormone replacement. At Absolute Healthcare, we offer several options for hormone optimization for men and women. We offer pellet insertion, and we offer creams and troches under the tongue, and we offer injections for hormone optimization. Hormone replacement is a great option for those who find that they are having difficulty with fatigue, sleep, libido, energy, mood, hot flashes, night sweats. It can be a real game changer and affect your life in such a positive way. There are many online options for hormone optimization, but it's very important that you see a provider who is trained and experienced, who will take your whole story into consideration when replacing your hormones. If you're ready to optimize your hormones, come see us at Absolute Healthcare of Georgia. We're a provider who cares. What bothers you the most about your face?
Usually right here,
The
and
nasal
then
labial.
down here.
So the marionette lines here, and then the nasolabial folds. So you have really good bone structure. You don't have a lot of fat loss. So by replacing this fat pad here, we can give you a little bit of a lift with the filler to refill the volume that you've lost. And that is what causes this fold here when we lose this fat pad, and this nasolabial fold that bothers you, both of those areas. Also in the mid face, you have just a little bit of volume loss right in here. So we're gonna replace that. We wanna bring our attention up to your cheeks and less attention to the lower face. So to do that, we're gonna inject your cheeks, your lateral fat pads here, a little mental shadowing in this area, a little in the chin here to kind of lengthen it, just to help you have a better contour. So we lose collagen starting in our 20s, and over time our skin becomes less elastic. So this biostimulator will help bring back a little bit of volume and also help her build collagen. We've done some radiesse in her lateral face, some contour in her mid face for that volume loss. Now I'm going to approach her marionette lines here. So we're finished with our treatment for today. We did her cheeks, her chin, marionette lines here, replaced some fat pad in her lateral cheek, and we also did her Xeomin Botox today. We are on a journey with her, and we will see her back in a few weeks for lasers, starting her on some really good medical grade skincare. And then over the next 3 months, you're gonna see a rejuvenation process and a great before and after. So we're looking forward to this journey.
Lip flip versus lip filler. Which is the best choice for you? So with a lip flip, we're using neuromodulators like Botox, Xeomin, Dysport, Jeuveau to relax this muscle above the top lip. And so what happens as a result, the top lip will slightly flip up, so we see a little bit more of that top lip, especially when smiling. So if you've noticed when you smile, you seem to lose that top lip, it gets really thin. A lip flip is a great option because in 2 to 3 days as it kicks in, you'll be able to see more of that top lip. So with lip filler or lip augmentation, we are using hyaluronic acid gel filler, and we are actually injecting the lip tissue to create more volume, more hydration, defining the border of the lips, and that typically is going to last longer and be more of a noticeable change to the appearance of the lips. So choosing between a lip flip or lip augmentation really depends on the look that the patient is going for and how long they want those results to last. A lip flip will typically last anywhere from 6 to 8 weeks. And then lip filler can last anywhere from 8 to 12 months depending on how much filler is used and the type of filler.
A common question I get from patients is, how do I treat these lines around my mouth? And a lot of patients already know that these are called nasolabial folds. To treat the nasolabial folds, you have to consider what's causing the nasolabial folds. Over time, as we age, we lose our fat pads, and we lose volume in the sides of our face, which is called the preauricular area. This leads to this fat pad falling. So to treat your nasolabial folds requires lateral cheek injections, mid-volume replacement. And then our piriform aperture right here, we lose bone in our nose, so these folds become more increased. The way to treat nasolabial folds includes a couple of different injection areas: lateral cheeks, mid-face volume replacement when it's needed, and support in this area called the piriform aperture underneath your nose. A lot of patients think that they're going to come in to treat their nasolabial folds and we're going to inject some filler into that actual nasolabial fold, but this will give you an unnatural look. So to treat the nasolabial folds, we don't actually inject much into the nasolabial folds. We treat the areas that have lost volume causing the nasolabial folds. A common area that people complain about or want treatment for is the under eye area. This is such a delicate area. It's very thin skin, so we begin to get wrinkling, texture issues with the under eye area. The best ways to treat the under eye area is a combination of treatments. The first thing that we do would be treating your crow's feet, which is the muscle that causes these lines around your eyes. And then we need to strengthen the skin underneath your eyes. Lasers help resurface this delicate area underneath your eyes, and they help build collagen to strengthen that thin skin up underneath your eyes. PRF biofiller is natural. We draw your blood and get your stem cells and growth cells out of this, and we make a biofiller that is all you. We inject this underneath your eyes to help build natural volume and to help tighten that skin. Treating that delicate tissue underneath your eye for the hollowing and for the crepiness of the skin requires a combination of treatments, which will include possibly some Botox, lasers, and PRF biofiller. If your under eye area is bothering you, schedule a consult with us. Today I have Miss Amy coming back for a follow-up. We have done a couple of rounds of Sculptra for her face to help tighten her skin and give her some natural volume. Today we're going to be working on more balancing by approaching her temple hollowing and then her lower face volume loss. Tell us what you've had done in the past with us.
I've done Restylane, some Dysport, and Sculptra.
You've done Sculptra, and you were tell me about how you liked your Sculptra results.
I love the Sculptra results because there's very soft, very natural. It's not noticeable as far as like a drastic change. It's very gradual, and I really enjoyed having it done.
Yeah.
I mean, like, I love it.
So today we're going to be concentrating on her temple. She has some natural temple hollowing here, right in the temple area. So we're going to work on that. And then another concern would be right here in her lower face. Just right here in these little marionette triangles, we're going to do a little volume replacement there. Part of aging is reabsorption of the bone in our face. What we're going to do here is a piriform aperture injection, which just is a big word for this area of the nose to give it support, because as we age we lose that bone, and our nose kind of sinks in, and it gives us this hollowing right here. So to support that nose, it also helps support the lip. It's an amazing injection just for support. Just finished doing her Dysport. So I'll see her in 2 weeks, and we will get some after pics and share those with y'all.